Hello everyone, I'm Juanito Khalif Bird or JC and welcome back to my channel. Again, if for those of you who are just new to my channel, I'm doing these vlogs to share with you my experiences and journey as a new physiotherapist here in the UK and hoping to help other people, especially those who are internationally qualified, and maybe inspire other people as well who are able to learn from the topic that I'm discussing. In this video, we'll be talking about working as a support worker. So I'm talking about physiotherapy assistants, rehabilitation assistants, technical instructors, unqualified member of the therapies team. So for those internationally qualified, you might relate on this thing that I'm going to tell you. So in my country, we don't have assistants, we don't have support workers, we don't have technical instructors or rehabilitation assistants. In the places I've had my clinical internship or work placement, we usually have volunteers who are already physiotherapists qualified, who are just gaining experience, but because in Philippines we have less opportunities to work in a paid manner, so they do volunteer work just to gain experience, and sometimes that will count to their credentials when they apply for a job. So we don't have assistants, we usually have volunteers, which are already qualified physiotherapists, as well as we're utilizing the students, the physiotherapy students or interns to work in the clinic or the workplace. So in here, you still have those students, but instead of volunteers, we have assistants. They are non-qualified members of the team who didn't go to the route of getting a degree of physiotherapy, but they can be well experienced, very skillful and very knowledgeable due to their experience, as much as a qualified physiotherapist, although they won't be working on that level. So in the UK they have bandings, so there's band 2, 3, 4, and sometimes 5 for a support worker role, or as I've said, either a physiotherapy assistant or a rehabilitation assistant, technical instructor, things like that. Some trusts have their different progression and have band 5s support workers, which already allocate leadership roles to some of the support workers. That's why they're on a band 5 level. So that's the idea of a support worker role. So it's just like care assistants for nurses. So for physios or for therapists, there'll be therapy assistant or physiotherapy assistants, or support workers. So that's that. For someone who's looking into a physiotherapy career and for the meantime wanted to be earning and have a job, this is a good opportunity for you, and yeah, just to gain experience and have an idea of how a rehab setting works. For those of you out there, just like me, who are internationally qualified, who came here in the UK, probably lacking experience, this could be a good opportunity as well to have that experience in the rehab setting. And I think that will be an advantage for you already if you have some knowledge and skills about physiotherapy or the rehab setting. However, when you apply for a job, it will always comes down to experience and the best the best choice in the job role. So for example, you're coming in just like a fresh graduate um, from abroad and coming here and applying a job. um, you might be lacking that knowledge about the healthcare system, experience about the therapy setting, how is it done here in the UK, things like that, which might be your disadvantage for those. I'm speaking on the perspective of an internationally qualified physiotherapist. Um, However, in my case, I took advantage of my experience because I started in the care home setting, as well as coming down to the job role that you're applying for. Because here, just like maybe in other countries, we'll have hospital-based and community-based. When you're applying for a post that requires additional skill, or perhaps needs to be able to drive, for example, when you're in a community setting, so that will be an advantage for you. So I took that opportunity as well to be in an advantage of having a driving license to apply for a rehab assistant job in a community setting. So for those internationally qualified physios who's looking into having an experience in the rehab setting, because you won't be able to do like too much of the clinical practice as a band 2-3, for example. But you're successful to apply on a band 4 or even a band 5, then you'll be able to gain some advantage on having experience on some of the standards already in the HCPC. For example, in a band 4, I think you'll be able to do some independent work, so a little bit of autonomous working, a little bit of contribution to multidisciplinary work, and decision making. You're able to liaise with the therapist and share decision making and be able to make recommendations. In my experience, you'll also get the chance to participate in things like clinical governance, doing some reports, assessments, writing letters, discharge letters, for example, liaising with professionals, things like that. You'll be able to use that as much as I did. And as you become a support worker, you can already grab the opportunity to become a CSP associate member, where you can take advantage of the benefits. You can have updates, news about the profession, gain trainings, CPDs, webinars, take advantage of those learning opportunities, make use of the union aspect where you can be supported at work. You can also be member or link in with the associates network where you can learn a lot and be supported with your role. And for me, in my experience, I think being part of the CSP's support worker reference group helped me a lot in my HCPC application. I think demonstrated my leadership aspect because I included that in my information in my application. Okay, so I hope that helps in terms of the topic. If there's any questions, don't hesitate to message me. If you're a CSP member already, please check out the CSP's mentoring scheme. If you need my help, just look for my name and I'll be able to link with you there. Okay, thank you for watching my videos and see you on the next one.